Joining me next is Dr. Balbir Singh. He is the Health Minister of Punjab. Thank you so much for your time. Dr. Singh, you're a doctor yourself. You
Yeah,
understand the plight of patients. You also understand the realities of the hospitals. So my first question to you is this. When the investigation shows very clearly that hospitals in broad daylight are saying we will simply not give treatment, impaneled with the government on Ayushman are denying flat out that forget emergency, forget, any kind of no Ayushman card will be accepted. How is this happening in your state, sir?
well, I have seen your report, and there are some, I would say, bad sheeps. And we have already suspended 3 hospitals before your report as well. And we have fined many hospitals to the tune of 1 lakh and 25 lakh, 1 crore and 25 lakh rupees. So there are some bad people, but I would say 85% people are doing a good job as well. There is no problem with the big hospitals like PGI, Sector 32, our own medical colleges, and most of the private hospitals as well. But there are certain bad hospitals, yes. We do take action, and we have de-empaneled some hospitals, and there are bad apples. So we will take very strict action. I have seen your report, and it's very commendable report, and it's a wonderful work. I appreciate India Today's effort. Yes.
So if I
This
can
is
name those hospitals for you, there is the Indus International Hospital in Mohali, there is
right.
Bhatia Hospital, Neuro and Multispeciality in Patiala, there is JP Hospital in Zirakpur, and these are just,
Right.
random
I have
picks
noted
made
that.
by our
I have
reporters.
noted the I have
I
noted the
want to know
hospital.
what is the specific action that will be taken against them, apart from just depaneling them.
You see, there is some issue also with your report. Neither the doctors nor your correspondent is aware. Like hip replacement is a reserve. It's in the reserve package. What it means is when it's in the reserve package, that means these are some of the procedures like total knee replacement, hip replacements. So any procedure which is likely to be misused, so we remove it from the private sector, and it's only available in the. They can go to PGI, they can go to our own medical colleges. So general packages
But they
now
were
we are going to.
dengue emergency patients as
Yeah,
well.
that's
We
very
went to
bad. It's very
emergency
bad.
centers.
No, no, all emergencies are covered. All emergencies are covered, even road accidents. We have a fresh day scheme for that, and we are giving them special rates for that. So that's very bad. It's, I mean, unbecoming of any doctor to say that. I have observed them. Yes, we will take very strict action against them.
So the last report that you saw there, a doctor who owns one of those hospitals says very clearly that they already have a lot of pending payment coming in from the government, and which is why he simply cannot afford to run the hospital this way. If you look at the numbers as well, a total allocation of 9,406 crore was made in the union budget last year. It has already been increased by 29%. Budget is around the corner. We are expecting another increase to happen over there. A lot of this allocation goes directly to the states. I'm trying to understand, where is this money going?
I will tell you, I mean, the very scheme of the central government is faulty. You see, central government owes Punjab 300 crore rupees. When we usually raise the bill, they are supposed to give, it's a 60-40 scheme. Central government 60%, state government 40%.
Hmm?
But they give us only, they say that we have a budget of 105 crores for Punjab. They have a limit. So they say it's a central government scheme. So they limit the budget, but they only actually pay us 20%. So all the states are suffering because of that. This scheme is like any other scheme. You see, smart city, you see the condition of smart city, Gurugram, Delhi, or any other smart city. So they announce the schemes with big fanfare, but they don't give the matching grant which should be there. How can they fix the budget? It has to be 60% because so many people are covered with that 16 lakh families in Punjab. Now we are going to give it to the entire population of Punjab, and we have already kept 1,200 crores for that. So the money does not come. Their portal was not coming working. So most of the problems are with the center NHA. So states suffer because state has to face, we have to face the people when they come for treatment. But the money does not come from the center. So the
Have you
problem is
raised this
there
issue
as
with the
well.
center, sir? We're again going into Aam Aadmi Party versus BJP over here. Would you
No,
say
no,
this
no,
is
no.
the issue
I
only
did
with
not say that.
Punjab, or would you
I am
say
giving
this
you the
exists
figures. No,
across
no, I'm
states
not
as
saying
well?
that. I'm not saying that. I'm saying that there are often delays. There are often delays, and the money allocated is much less than what is the share of the center. These are facts. I can give you the facts. I have met the Honorable Union Health Minister twice for this. I've written DO letters for this. I can share with you. You see, they told us to get the audit done for the previous year for the Congress's name. We did that also. We submitted the reports. So there is a problem. I'm sharing with you. So there was a problem that even in Punjab, the money had to come from Mandi Board. It has to come from excise department. Now what we have done is we have made it budgetary scheme. So the new scheme is a much better scheme. It's the money is there in the budget. It's a universal scheme. There will be no delays. So we are going to start it on 15th of January, and this is the first of its kind scheme in the whole of the country. And we already have a primary
This
care.
is a separate scheme from what Ayushman is?
This is a separate scheme. This is Mukh Mantri Sehat Yojana scheme, which covers the entire population. It covers the 3 crore people of Punjab.
You have
Everybody
money for that, but you don't have money for a national scheme.
No, we have blended it with that because they cover only 16 lakh families. We have 64 lakh families, 65 lakh families. They cover only 25% of the families, and for those families also they pay only 25%. They are supposed to pay for 60%. That is the issue.
Dr. Singh, this sounds really dodgy to me. You are saying you have money, you will start the scheme. You will start the scheme only under your state government and not take a national scheme.
No, we are taking the national scheme. Those beneficiaries who are eligible, the only SCCC families are eligible for national scheme. There are exclusion criteria. They take only very few socio-economic and caste census families. Only a fraction of the families they take, but we are extending it to all the families of Punjab. It's a universal. This is the first of its kind. I tell you, all the states will follow suit.
Yeah, but
And
Dr.
we have
Singh,
doubled the coverage.
we don't want people and their hardships are not divided by state borders, no? People
No,
in
that's
hardships,
true.
I'm sure people of Punjab who come under your state, who vote under you, they travel to other states as well, right? They travel and they would require the same scheme. Why would you not follow the one nation, one card sort of philosophy here, one nation, one health sort of a philosophy here, which actually helps?
I will tell you, we are using the NHA portal only. We are using the same portal. We are using the NHA portal. And you see, for those 16.5 lakh families, there will be all India portability. But for for the state scheme, only the state hospitals and the Chandigarh hospitals are, and only the people are eligible in these hospitals.
Dr. Singh, before speaking to you, I thought the hospitals were not really doing their bit, but after speaking to you, I feel like there's a bit of politics involved here as well.
No,
I'm
no, there is
afraid
no
to say
politics. There is no politics,
that's what
ma'am.
it's come down to.
This is a universal scheme. We are upgrading it. We are doubling the amount coverage from 5 lakh to 10 lakh, making it universal. So we are only making
Where
it
will you
better.
get
We
the
are
money
working
if
with
you're
the
saying you
center.
don't have the money under the state, the central scheme and the government is not giving it to you? What you
No,
have,
sir,
you're going to give it out, but under a different name.
No, I am giving you the facts. We are paying even the center's share. We have only pendency for 1 month, so that the hospitals, they also don't suffer. Because the principal reason for hospital to refuse treatment is when their payments are pending. So we are taking care of that, but there are fraudsters, and we deal them with very strictly. Yes.
We hope to see that action come through. Dr. Singh, for
Yeah,
now, thank you
definitely.
so much. Thank you so much for
Definitely.
joining
Thank you
us.
very much. Thank you very much. Thank you.
All right, so that was the Health Minister of Punjab over there. You heard his views. I leave it for you to decide what you made out of it.